I first became aware of the Friends of Medicare pretty much, when it was formed in that 1979-1980 period. I was involved. I was living in the Macaulay neighborhood in Edmonton, and a number of us, including myself, when we were in our early to mid-20s, helped form the Boyle-Macaulay Health Center. And I think, my awareness of Friends of Medicare came because of two issues that, that were really hot back in, the 1980, early 80s period. First had to do with extra billing. That's probably the best known one. And certainly, again, being involved with an inner city health center, we were even hearing, doctors were wanting to charge extra. The feeling was that, if you couldn't afford it, you wouldn't have to pay, but things don't always, work that easily, right? Despite the insurances and I think it's really important to remember that at the time, the medical profession saw this as as a major right that doctors had to extra bill their patients beyond what they were allowed to bill the public healthcare plan for. So that was one issue. The second issue had to do with, at that particular time, if you didn't pay your healthcare premium, you could actually lose your healthcare coverage. And so we basically, those of us who were involved with the Boyle-Macaulay Health Center, and whether it was already called Friends of Medicare at that time or not, but we certainly collaborated, with a number of others, including people in the labor movement, including people already like Dr. Richard Plain, I now remember, from the University of Alberta, who's always been very helpful to our cause. And I remember even then, did a lot of economic analysis to show, the phoniness of doctors being hard done by, and also sort of about how it really, this was something that had been growing, since Medicare was brought in about the mid-60s, the extra billing, and it was getting, worse and worse, and so this was, a big fight, and in my view, a huge achievement, not only for Friends of Medicare here in Alberta, but in terms of partners across the country, to convince, interestingly enough, Monique Béjean, I believe, may have been the federal health minister, and somewhat to the surprise of a number of us, the federal conservatives at that time, and that was probably during the Joe Clark and maybe after Mulrooney became, somewhat to our surprise, they actually came on side with the banning of extra billing. As far as the other issue about, that also took, considerable effort to convince the provincial government that people who, couldn't pay their healthcare premiums should not be should not lose their healthcare coverage. I believe there were also some appeals to Monique Béjean again on that issue, and I think there was clarification to the Alberta government that while they had the right to levy the premium, they had no right to kick people off of healthcare coverage if they couldn't afford to pay their premium. So I think those were two pretty tangible achievements that Friends of Medicare and others in the community were involved in during those early years.
Great. It seems to be that right from the beginning, in terms of the threats to Medicare, to the Medical Care Act, that Alberta was leading the way. Was it the case here? Was this largely an Alberta phenomenon? And if so, how did it end up playing out here in Alberta? Because as I understand it, the Alberta government kept it up for a while, kept up insisting that this wasn't going to
Yeah, well, I personally think at that particular time that the Alberta government was amongst the strongest supporters of the, like the Canadian Medical Association and others who were insisting on the right to extra bill. And you're quite right, it's only when the federal government put a stop to it and amended the Canada Health Act to put a stop to extra billing that in a sense the Alberta government was, in a sense had to kind of back down. on that particular issue. And I believe, again, there's been a bit of a pattern of this. I think the same thing applied to the other issue of if you couldn't pay your premium, you could lose your health care coverage. And the reason we became aware of that at the Bow-Macaulay Health Center is we were getting people, even though we were supposed to be serving people in inner city neighborhoods, we were getting people from all over the city. And when we asked them why they came, it's because they had lost their health care coverage. Because then, and when we asked them why they lost their health care coverage, it's because they were behind in paying their premiums. So again, I'm pretty sure there had to be an appeal to the federal government to get the Alberta government to back down on that as well. Now, admittedly, it was 30 years ago. My memory could be a little bit fuzzy, but that is my recollection.